Thank you, Mr. President. I, too, would like to talk about health care. And as we speak here in the Senate, the House is preparing to debate and reportedly vote by late this week or early next week on a massive new health care bill that will dramatically expand the size of our government, dramatically increase taxes, and establish a government-controlled insurance system. While in the Senate, we are not yet clearly aware of what the bill we will be debating is, because it is still being crafted behind closed doors. We have an idea, and we're pretty sure that some of the elements that are going to be included in it are the same elements that we debated in the Finance Committee and the Help Committee as those committees worked on their product here. And in that context, we expect that we will see also, here in the Senate, a massive new expansion of the size of government, up to $1 trillion or more. And if it's anything like what the Finance Committee bill was, we'll see taxes increased on the American public by over $500 billion. We'll see cuts in Medicare, which we discussed yesterday, of over $400 billion, and a significant expansion of the control of the federal government over our healthcare economy. Today, I want to focus on just the tax piece of this situation. One of the most common provisions that we have seen here in the Senate that we clearly expect will be in the final bill is the proposed 40% excise tax on high-cost or Cadillac healthcare plans. This has been defined as healthcare plans that are valued at more than $8,000 per a family for an individual, or for a family valued at more than $21,000. And it's important to note that these thresholds are not indexed to the increasing costs of inflation, but instead are of healthcare spending, but instead are indexed to inflation +1, which means that over time, this will, just like the alternative minimum tax, eat further and further into the American public's healthcare plans, which will then be taxed. The Joint Committee has scored this tax to generate $201 billion of revenue to pay for that portion, $201 billion worth of this new federal spending proposal. And many think that because it's called an excise tax on healthcare plans, that it's not going to impact them. But they'll be surprised to learn that in my questioning of the Joint Tax Committee, we were told that the vast majority of this $201 billion tax is expected to be collected directly from the middle-class Americans, individuals who will be paying more income tax and payroll tax. Now let's figure out how that can be. It turns out that as you analyze the way this tax is going to work out, employers who will face a 40% excise tax on the health care that they provide to their employees will begin to adjust the value of their health care plans so that they avoid the tax. As they do so, they will reduce the health care that they are providing to their employees, and presumably, and we expect that they will, increase the wages that they are paying to their employees so that their employees' net compensation is not changed. The result of that, though, is that since the health care portion of the compensation is not taxed, and the income portion of an employee's compensation is taxed, that the employee will actually pay higher taxes both on income and on payroll tax levels. Maybe a real-world example to show how this would work will demonstrate what we're saying. In my state of Idaho, the Census Bureau says that the median household income is about $55,000 per year. In this case, let's just take an example of a single woman who currently earns $60,000 per year in annual compensation from her employer. We have an example represented with this chart here. And let's assume that she has a $10,000 value health policy. So her total compensation package from her employer is going to be $60,000, $50,000 in wages, and $10,000 in employer-provided health care benefits. She's taxed on $50,000 and gets the $10,000 health care benefit without taxation. What will happen in the bill, though, as I've already indicated, is that this $10,000 health care policy will be subject to a 40% excise tax. And in order to avoid that excise tax, the company will simply react by reducing her health care policy to below $8,000 and increase her income. Now let's put up the next chart to see what is the very likely reaction of the employer. Not to pay the insurance fee as many are saying here, but simply to skip that and direct her tax dollars to the federal government. If this new high-cost plan is to be enacted, the theory is that her employer will make the adjustments to change her overall compensation package in a way that she ends up with higher wages. Let's put the next chart up to show exactly how this would work. Under this proposal, her health care benefits are going to go down. Let's assume that the company reduces her health care benefits from $10,000 in value to $6,000 in value and gives her the extra $4,000 in income. Her health care benefits will go down. She'll pay more taxes because she now has $4,000 more of her compensation package that's subject to taxation. And the net value of her compensation will go down because of her increased taxes. And the result here is that we are going to see millions of Americans pay this excise tax squarely in contravention of the President's promise that no individuals who make less than $200,000 will pay income taxes or payroll taxes or, in the President's words, any other kind of taxes. And just so that we're clear on this, the estimates are that 84% of this tax is going to be paid by those who are earning less than $200,000 per year. As a matter of fact, if you just look at those who make less than $50,000 per year, we expect that somewhere in the neighborhood of 8 million Americans will fall into this category. If you look at the number who make less than $200,000 per year, we expect that number will be above 25 million Americans who will be paying more taxes, both in payroll and income tax, and receiving less health care benefit from their employer. Mr. President, the net result of this is that the President's promise that you can keep your health care if you like it will not be honored because of this provision. People will see necessarily that their employers will begin reducing the health care packages to make them fit the tax structure that this bill will create. Secondly, the President's promise that if you if you make less than $200,000 as an individual or $250,000 as a family, that you will pay no taxes under this proposal. Yet, as we've seen here with just this one example, and there are a number of other examples in the proposal that's being developed, in this just one example of $201 billion worth of the new taxes in the bill, those making less than $200,000 will pay over 80% of it. And it will come directly out of their pockets in their compensation package with their employer. Mr. President, in the time I have left, I want to just focus on one additional element. There's also a proposal to increase the bar for deductions of health care expenses. In other words, those who deduct their expenses and itemize their deductions can today deduct that portion of their income, over 7.5% of their income, that is represented by their health care expenses. This bill will increase that to 10% and generate over $15 billion of additional taxes in that format. And who's the most likely to pay these taxes? People who have relatively low health care costs are going to end up not meeting that 7.5% threshold, now to be brought to 10%, and probably will not be able to benefit from the deductibility of their health care. But those who face medical crises, those who have health care expenses that exceed the value of 10%, will see their deductibility reduced again by these proposals. The net result, millions of Americans making less than $200,000 a year will pay more taxes. Mr. President, I see that my time is up. I just want to encourage us as we move forward in the debate on this proposal to recognize that the tax provisions contained in it are squarely going to hit those in the middle class.